Well, Western Australia's peak doctors lobby has accused West Australian authorities of refusing to release basic data to provide COVID information to the public. Authorities have instead given a dumbed-down version of the modelling. It has no start date or figures or even an author. This modelling was the basis of the state's 2-year long, hard border with the rest of the country and other public health restrictions, some of which are still in place. Joining me live now is the AMA Association WA President, Mark Duncan-Smith. Mark, I can't really believe what I'm saying at the moment. Is this right?
Yeah, look, unfortunately it is. I've been calling for the release of the full modelling so that it can actually be scrutinised, peer-reviewed, which is what you normally do with a scientific paper. The lack of transparency of this is not the sort of thing we'd expect with a sort of a transparent democracy. This sort of secretivism is really more like a sort of secretive, autocratic type of government. So actually, it's very disappointing at a philosophical level, at a practical level. There's no way that we can actually look at this modelling and use it and say whether or not the government and the state, for that matter, the people of Western Australia are ahead of the curve, behind the curve, or where they are on the curve, because we don't even know what day zero was. So it really is unacceptable.
To be fair, I mean, how does Mark McGowan get away with this?
Well, he's got control of both the upper house and the lower house. The West Australian people gave him that power. And essentially, there's not much we can do about it. He's in charge. McGowan government's in charge. And basically, the full modelling is remaining top secret.
Wow. Okay, so we were told as well that the reason that he wasn't opening the hard border, there was very little compassion given to reuniting families because they needed more time to get more people vaccinated and to get the hospitals ready. Tell me at least the hospitals have improved.
Well, look, it's a big combination of things. The hospitals have improved in that we've got better systems, better clinical protocols, better methods of communication, transportation. Things certainly have honed over that month that we delayed. But more importantly, the vaccination rate, especially for the boosted, got up to pretty well 70%. And that's a 98% protection for each of those people against severe Omicron disease. We've also got very good hot weather here still. We've got the IV and also the oral antivirals have come online. And this whole combination has led to really low numbers, which is great for the people of Western Australia. And people of Western Australia are also still compliant with the restrictions that we're in. And they are certainly to be congratulated for the work that they're doing in keeping the peak quite low. But where we are on that peak, where we are on the curve, only the government knows.
Yeah, well, I'm not sure even they know at this point. There's about 5,000 cases a day, or there was at least yesterday, of COVID cases. So, I mean, was it worth it? I guess the question is.
Well, look, it does appear that it has been worth it. We're predicting a peak of around 10,000 cases based on their modelling. They've given us that figure at least, and we're still a way short of that. So it would appear that we've got a very slow curve. But again, whether we're ahead or behind the curve, we just simply don't know. We've just got to trust them. And sort of that sort of situation is acceptable if governments are always right in some sort of nirvana. But last time I checked, Western Australia wasn't called nirvana, so I find it unacceptable.
I think what we're looking at as well is there's a mistaken view that an overall majority and a convincing election win somehow negates a democracy. Do you feel like that's happened?
Well, look, in general terms, I think the West Australian government has done a good job, but there's been a few problems with compassionate. Even we had a problem a couple of weeks ago with they were banning loved ones and partners from actually visiting relatives in hospital in the face of nightclubs still being open, which I just found, I was absolutely gobsmacked. And fortunately, they turned that around in a matter of a few days. But look, overall, they have done a good job, but there's just a few points where they could have been more compassionate, a little bit more common sense with what they're doing, and I certainly still call on them to release the full modelling.
Yep, we'd like to see that full modelling. Before I let you go, what are you seeing in terms of the level of disease of COVID in patients presenting in Western Australia? Again, this might go back to the modelling and the information that you might not have available to you, but are we looking like, with a highly vaccinated population, that this is like the flu?
Well, it's not quite like the flu, but we are certainly seeing moderation of disease. And the delay and the achieving 70% boosted in the population is certainly reflected in the lack of severe disease. So although we've got 5,000 cases a day, although we've got about a handful of people in ICU, that handful of people really should have been about 20 or 30 at this stage, where it's only about half a dozen. So it really would see that the boosted rate is protecting society from severe disease. And as such, keeping the borders closed that extra month has achieved the outcome that was desired.
Mark Duncan-Smith, always appreciate your time. You're a very busy man.
Take care. Thanks very much.